All right, everyone, we're about ready to get started. So welcome to the third MESA lab. This lab is covering the put your money where your mouth is. It's a little bit of a walk through the oral cavity. My name is Dalton McDaniel, and I'll be doing the presentation part.
I'm Emily, and I'll be leading you through the dissection.
And those of you who are in our Kirksville location are lucky enough to have Kayla and Katie, our other anatomy fellows, with you in the lab. Give me 1 second here to share our screen, and then we'll get started. Okay, so as I said, this MESA lab is titled Put Your Money Where Your Mouth Is. It's a little bit of a walkthrough of the oral cavity. And so what we're going to start with is going to be the lips. So you probably all know where your lips are, I'm sure. But what's important about them is that they're the opening to the oral cavity. And so in being an opening to the oral cavity, they're also a valve for the GI system, and they help to keep food in while you're chewing. They also perform precise movements for the lips and then help with articulation of sound so that we can speak words clearly so you can hear one sound from the next. In addition to that, something weird about them is that they lack hair follicles and they lack oil glands. So what this means is that they can easily dry out, unlike other skin, which is obviously why many people use chapstick. And so our first clinical correlation is chylitis. And what chylitis is inflammation of the lips. Now this can range anywhere from just chapped lips, which you see on the left, to widespread inflammation, such as the picture on the right. Another little clinical correlation is herpes labialis. So herpes labialis is better known as like the common cold sore, and what it is a compilation of painful blisters that can be either on the inside or the outside of the lips. And this is caused by the herpes simplex virus type 1. It's very common and can infect up to like 50% of the population at any time. These lesions usually heal on their own after about 10 days, but the virus actually lives inside of you lifelong. So they can come back anytime that you're stressed out or if you are immunocompromised from some other infection or anything like that. And they typically sting with acidic foods like either drinking orange juice or eating ketchup or things like that. So next we're going to talk about the muscles of facial expression. So we talked about the lips. Now these muscles are just kind of deep to the skin and deep to the lips. So they're literally the muscles that allow you to make faces. That can be smiling, frowning, wrinkling your nose or your eyebrows. Just depends on which muscles are actually contracting. Some of the specific ones that affect the oral cavity are the ones that help you to move the lips. Now, the first one of these that we're going to talk about is Orbicularis oris, and this is the circular muscle that you see here on the slide, kind of wrapping around the lips. And that's what's mostly just underneath the skin and helps to close the mouth by pulling the lips towards each other. The Levator Abi Superioris, which you see on the left side of the screen, where the arrow is, right here, is attaching to the angle of the mouth, or what most people call the corner of the mouth, and it helps to levate or lift the lips on the outside corner so that it can help you smile. So you have one on either side. The Depressor Abi Superioris is kind of the same thing, other than that it's below the lips and attaches to the bottom corner of the mouth, and so it helps you to frown. The Levator Abi Superioris and the Depressor Labii Inferioris are kind of similar, except for that they attach more midline to the lip around this region, and the Levator Abi Superioris helps to lift, while the Depressor Labii Inferioris helps to depress the lips. So once we get deeper to the muscles, we can talk about the bones of the jaw. And so when we talk about the bones, we really have two major parts. The mandible, which is the lower part, which is mobile. So that's the part that's moving while you're talking or chewing. And then the maxilla is the major bone of the upper part, and that's stationary, so that never really moves when we're talking or chewing. And the upper portion is also formed by the palatine and sphenoid bones, but I haven't shown you them in this picture. They're much smaller bones and are usually not talked about as much with the oral cavity. So we talked about the muscles of facial expression, but now we have the muscles of mastication. And so the muscles of mastication are the muscles that are working while we chew food. Really what they're doing is moving the mandible around in different directions. And so the first muscle that we'll talk about is the temporalis. So if you clench your teeth together, you can feel this muscle kind of in the temporal region. And it also attaches to the inside of the mandible and helps to elevate it or lift it up. The next muscle is the masseter. And if you clench your teeth together again and then tap on your cheek, you should feel a little hard part of your cheek, which is the muscle contracting. This muscle also helps to elevate the mandible. Next, we have the medial and lateral pterygoids, which are much smaller muscles. And the medial one is found closer to the midline of the mouth than the lateral one is. Both of them work together to allow you to move your mandible from side to side. All of these muscles of mastication are innervated by a different nerve than the muscles of facial expression. So the muscles of facial expression were innervated by the facial nerve, but the muscles of mastication are innervated by the mandibular nerve, which is one of the three major branches of the fifth cranial nerve. Next, we'll talk about the teeth. So a common myth about the teeth is they're actually not made of bone, although many people incorrectly think that they are. Their main use is obviously for the breakdown of food. What's something that's kind of interesting is that humans are polyphyodont, and what that means is that they have more than one set of teeth in their lifetime. So as you probably know, when you're a baby, or when you're a young child, you grow baby teeth, or which are actually better termed deciduous teeth, and you have 20 of those total. But those fall out and are replaced by permanent teeth, of which we have 32 total. So this is different from some other animals, which can either be monophyodont, which means they only have one set of teeth their whole lifetime, or even different from other polyphyodonts, such as some sharks, which get a new set of teeth about every 2 weeks. So of the different types of teeth, the first ones that we're going to talk about are going to be in the middle, and the top and bottom, so for a total of 8. These are the incisors. Now the incisors are flat in the front, but they're fairly sharp so that they can help to cut food. And they're typically the first of the baby teeth to show up. The next type of tooth that we're going to talk about are on either side of the incisors, and they're the canines. And so the canines are on top and bottom, one on each side for a total of 4. And they are sharp pointed teeth that develop to firmly hold food and so that we can tear it apart. This isn't so much important in humans as it is in other animals where they actually have to hold their food. They don't have forks and hands that they can hold the food with. The next 2 teeth on both sides, in the top and on the bottom, are the premolars. So we have 8 total premolars. And the premolars have a little bit of a flatter surface, and so they're most useful for crushing food. The last type of tooth that we're going to talk about are the molars. So we have 12 total molars, 3 on each side, on top and on bottom. These aren't really a kind of baby tooth, which is why we only have 20 baby teeth. They only grow in as permanent teeth. So the molars are the biggest and the flattest. They have the biggest and flattest surface of all the teeth, which makes them great for grinding and crushing food into smaller pieces. So another little clinical correlation for y'all is tooth impaction. This is a very common problem with molars because when they grow in, they can tend to grow at an angle. And so the picture that's shown on the slide is an x-ray of someone's mouth with the red arrows pointing to molars. So these molars are kind of caught up on the tooth that's next to them, and they can no longer grow up, so they're kind of stuck there. As I said, this is pretty common, and the reason that it is the reason that most people get their wisdom teeth out. And so the wisdom teeth are just another name for the third molar on either side, and they're the last ones to grow in, usually somewhere in the teenage years. Now, when we talk about the different parts of the tooth, there's a couple different ways to look at it. The first way is to look at either the crown and the root. So the crown is the visible part of the tooth above the gum line, and then the root is everything below the gum line, and it actually makes up about 2/3 of the length of the whole tooth. Second way to look at the layers of the teeth is to actually look at the layers. So first we have the enamel, which is the outer calcified white part that covers only the crown of the tooth. This part is really hard and it protects the tooth from wear and tear. The next part is the cementum. That's not actually shown in this picture, but it only covers the part of the root, and so it helps to hold the tooth into the surrounding gum. The next deeper layer is the dentin, so that's kind of the middle layer of the tooth. It carries some of the nerve fibers for sensation of teeth, but not really too many of them. And then the deepest part is the pulp. So the dental pulp, or the pulp, is the center of the tooth, and it has most of the blood supply and the nerves traveling in and supplying the tooth. So we can't really talk about teeth without talking about tooth decay and dental caries, which are better termed cavities, or more commonly termed cavities. So first thing that kind of happens is that plaque forms on the tooth. Now, plaque is a combination of sugars and bacteria which adhere to the tooth. After layers and layers continue to form of the plaque, it hardens and it forms what's called tartar. Now, this tartar and the bacteria and sugars that are within it form acids which erode through the enamel, like shown in the second picture here. This takes a long time to truly erode through the enamel, and it's typically not painful because there's no nerve fibers within the enamel, so most people are kind of unaware that they have this tooth decay. The second part is when the erosion gets through the enamel and starts to get into the dentine. And so when it's in the dentine is much softer, and so erosion through here occurs quicker, and it's somewhat painful because of the nerves in this layer. As I said, there's some nerves, but not a lot. Now, if the erosion continues on and gets into the pulp, it can really spread quickly, and this is very painful due to the number of nerves that are within the pulp. So if we look at kind of the same sort of images in the first two pictures here, so this is erosion that we just shown, and what it can do is form a pocket of inflammation and infection, which is called an abscess. So tooth abscesses, if they're visible, can look like the picture on the left, and they're very painful and require treatment. But if the inflammation gets even worse, they can extend far enough and cause a visible swelling of the mouth, as shown on the picture on the right. So one way to treat a tooth abscess is with a root canal. And so this is only really if the abscess itself is affecting the root of the tooth. So what we do with a root canal is the dentist will form an opening in the tooth using a drill, and then they'll go in and they'll clean out all of the inside of the tooth. So cleaning out all the infection, all the inflammation, as well as the nerves and blood vessels. Then they go ahead and they fill the root of the tooth up with this cement-like material, which will harden, and then they'll seal it off with a filling. Once it's sealed off with a filling, it's okay, but a lot of people will elect to get a crown to cover it up to make it look more like a real tooth. So as I kind of mentioned the fillings already, but if you're lucky enough to catch the decay early, while it's still in a cavity stage, instead of really an abscess, you can just get a filling. And for this, it's the same kind of process where they take a drill and they pull out the decayed material, and then they just kind of seal it off to the external environment with either a silver filling, as shown in this picture, or a white filling, as shown in that picture there. So the next thing we're going to talk about is the gingiva, which most people just refer to as the gums. All the gingiva really is a specialized skin layer that lines the inner part of the jaw and deeper portions of the teeth. So it acts as a barrier to protect deeper structures to keep the teeth in place. So a clinical correlation that affects the gingiva is gingivitis. And really this is inflammation of the gingiva, so it can cause redness, irritation, swelling, can be painful. You can even have some bleeding of the gums. An unhealthy gingiva allow disease to affect deeper structures, which can eventually lead to tooth loss. The most common cause for gingivitis is just bad oral hygiene, so like not brushing your teeth, not flossing, things like that. And so in case you wanted to compare, the picture on the left is normal gingiva, while the picture on the right is gingivitis. The next thing we're going to talk about is the tongue. And so the main job of the tongue is to move food and then help to articulate words. And it's also where sensation of taste begins with little taste buds. So the tongue itself is made mostly of muscles. There's different kinds of muscle. Intrinsic muscles are muscles that only run inside of the tongue. And they're innervated by the hypoglossal nerve, which is cranial nerve 12. The extrinsic muscles are muscles that attach between the tongue and other structures. So they can help to move the tongue somewhat, but most of the movement actually occurs by the intrinsic muscles. A little portion of the tongue that we're going to talk about is the lingual frenulum. And what the lingual frenulum is a fold of membrane that connects the floor of the mouth to the middle of the underside of the tongue. And it acts as an anchor for the tongue. So if you want to look at your partner, someone who's next to you, and just have them lift their tongue up, you should see this little fold of membrane connecting to the floor of the mouth. You might also notice that we have frenulum for the upper and lower lips, although they're a lot harder to see than the one for the tongue. So on the tongue, on the surface, we have a lot of small projections called papillae, and there are 4 major types of papillae. The first one is the filiform papillae, which are little pointed projections. They look like little dots, and they're located all over the tongue. The next kind is the fungiform papillae. These are little mushroom-shaped objects, and they're found usually on the sides and the tips of the tongue. Then we have valate papillae, also called circumvallate papillae. These are really large circular papillae, and they form a V shape on the back of the tongue. I think you'll see these with the pig dissection a little bit later on. You may not see them if you're looking in a partner's mouth just because they're pretty far back. The last type of papillae are the foliate papillae, and these are only usually found on the side of the tongue. And then all of these papillae, except for the filiform papillae, have what are called taste buds. And so the taste buds is where we said the sensation of taste actually starts. So if you haven't already, go ahead and look at your partner's tongue and see if you can see some of these little dots on their tongue. So something that's kind of uncommon, although it does affect 2 to 3 out of every 100 people, is a geographic tongue. And geographic tongue is characterized by areas of smooth red, as you see here, and then with patches of this white. It's called geographic tongue because people say it resembles a map with patchy islands. Now, I think that takes a little bit of imagination, but whatever, right? It's not really a problem, and there aren't really any symptoms related with it. It's just kind of like an abnormal thing that doesn't have any issues. So the next thing to talk about is oral candidiasis, and most people just call this thrush. What it is a fungal infection which grows on the tongue, and it actually can be anywhere in the oral cavity. It's just kind of more common on the tongue. And it's really common in babies when they're given antibiotics to treat a different illness. It's easily treated with an antifungal medication and doesn't really cause any long-term effects. Next, we'll talk about the palate. And so the palate is the roof of the mouth. So imagine that both of these pictures are taken inside of your mouth looking up. The palate separates the oral cavity from the nasal cavity above, and it's divided into the hard palate in the front of the red line here, which is made up of bone, and then the soft palate behind the red line, which is made up of numerous muscles, as you can see in these pictures. So when you look again at the palate, you might notice that the greater palatine nerve and artery are running forward, innervating and supplying the hard palate, as shown right here by the arrow. And then the lesser palatine nerve and artery run backwards to supply the soft palate and the muscles. This is important because during a dental procedure, a dentist can inject anesthesia medication near the greater palatine nerve, which can limit the pain that you feel with the teeth or around the injection site, but it can still allow you to move those muscles of the soft palate. You might also notice at the bottom of this picture, in the back of the mouth, the uvula. And we're going to talk about that a little more in just a second. So the uvula is a muscular structure that hangs in the back portion of the soft palate. And it normally hangs in the middle, so doctors use it to see if there's any problem with the nerves that innervate the soft palate. And so the muscles of the soft palate will pull up on the uvula to either side. And so if there's a problem with the nerve, say where the X is in the picture, which would be the patient's left side, the uvula will actually pull to the patient's right, as shown by the arrow. Another clinical correlation, or something that's kind of different about the uvula, is that some people can have what's called a cleft or bifid uvula. So a cleft uvula occurs when the two sides don't fuse together during normal development as an embryo. Although it's abnormal, it doesn't really cause any real problems. It's just kind of something that you can see. So go ahead and take another second to look at your partner's mouth and see if you can see their uvula in the back. Next thing we're going to talk about are the tonsils. And so the tonsils are formed of lymphoid tissue, which means that they're part of the immune system, and they're really the immune system's first line of defense against something that's ingested or in your mouth, any sort of pathogen such as bacteria or virus. They become enlarged when fighting an infection. And so because they become enlarged when fighting an infection, doctors typically grade them if you're sick and complain of a sore throat. And so when the tonsils are removed, you see they're graded as a 1, as shown in the top left of the picture. They get a higher number as they get bigger and become more inflamed. And so the highest grade you can get as a 4 is when the tonsils are actually touching each other. The last thing that we're going to talk about is the salivary glands. And the salivary glands produce saliva, which gets secreted into the mouth. That's important because it contains enzymes which start to break down food, and they also contain immunoglobulins which help to fight pathogens that could cause an infection. There's 3 different salivary glands on each side of the mouth. They're the parotid gland, the submandibular gland, and the sublingual gland. We'll talk about each of these a little bit more. So first, the parotid gland is the biggest of the 3 salivary glands. It's found in the cheek outside of the oral cavity and outside of the muscles. You'll see this gland in the pig dissection a little later. So its secretions have to travel through a duct, which is either the parotid duct or sometimes referred to as the Stenson's duct, in order to get into the mouth. Something that can happen with the parotid gland is called parotitis. That's inflammation of the gland, and it can be caused by a number of things. It could be bacteria, viruses, autoimmune diseases, just stones that get in there and cause a blockage of the duct. But one of the most common causes from years ago, and it's actually becoming a more common cause now because people are not getting vaccinated, is viral parotitis, and it's caused by the mumps virus. And one reason why this is important is because this infection can cause serious long-term effects like meningitis, permanent deafness, and even infertility. So the submandibular and salivary glands. So the submandibular gland produces the most saliva, although it's not as big as the parotid gland. It's located near the bottom portion of the mandible, and so its secretions also have to travel through the submandibular duct and then through the sublingual papilla in order to get into the oral cavity. So that's kind of a weird naming. It's called the submandibular duct, even though it's also the sublingual papilla. That's especially weird because the next one that we have is the sublingual gland, and that's located just under the tongue. So although it's called the sublingual gland, it has its own ducts, and there's usually between 8 and 20. As you can see, there's about 4 shown in this picture. But it doesn't have a sublingual papilla. So it produces the least amount of saliva of all 3. And then that's all we have for the presentation. Does anyone have any questions? If we do have questions, you can have your site coordinators kind of chat them to us through the computer. If anyone does come up with a question, we'll be here for a little while to take them. If no one has a question in your location, you can go ahead and go into the break. We'll break for about 15 minutes. So we'll start around 5:20 or 5:25. We'll check in to make sure you're all ready.
All right, hello again, everyone. We're going to get started with our fetal pig dissection. First, you should have your pig already, and I just want you to have your pig laying on its side like this in my view here. And the first thing I want you to do is just kind of palpate the pig's cheek so you can feel the masseter muscle. This is kind of the area that we are going to be dissecting first. So just see it's a really large round muscle. So you should be able to feel it pretty easily through the skin. So I just wanted to point that out because pretty shortly here we're going to be cutting the skin away from that muscle. So as you're pulling the skin away from it, you want to try to not cut that muscle or any of the structures around it, because that's what we're going to be looking at. So once you find your masseter, then turn your attention to the corner of the pig's mouth, right here. Okay. And you're going to want your scissors, because we're just going to make a short cut at the corner of the pig's mouth. And you want to aim it towards the pig's ear. Okay, so just make a short cut there, should be through the skin. Okay. And then you can kind of dig your scissors in a little bit deeper, and you want to just go just under the skin. Remember, don't get into that masseter muscle. Okay, so just keep aiming towards the ear. And as you're going, use your scissors to separate the skin from the underlying structures. And you want to kind of use a motion like this with my scissors. I'll show you here. You want to kind of move your scissors outward as you're going through the tissue. So you want to separate that skin this way. So that's just a technique we use to easily remove that tissue. Okay. You can continue your cut towards the ear. All right, now we're starting to see some structures as I pull away the skin. This is what you should be seeing on your own pig. And you can kind of cut the skin away on either side to kind of make flaps, or you can completely remove it if that's easier. I think I'll do that with my pig. Just kind of totally remove this skin flap here. Okay. All right, hopefully once you remove the skin, you should kind of see a window like this with the skin removed. You can kind of take your probe to identify the structures in this window. So first, let's just get back to that. Let's just take another look at the masseter. Just take your probe and pull some of that tissue away that's covering that muscle. This is what we were palpating first before we started our cuts. Okay, and you can go ahead and feel it. You can feel how it's a nice, firm structure. It's really large and round. And remember, this is the muscle that helps you chew or clench your jaw. That's the muscle that you're using. Okay. Now, if you look just behind your masseter here, you can see this kind of spongy-looking tissue. It doesn't have a really distinct shape to it. Some sources I found say it's supposed to be triangular. Maybe you can see that in your pig. If not, that's okay, but you should just be able to see this little brown spongy tissue right behind your muscle. And that's the parotid gland. So go ahead and see if you can find that on your pig. So far we just have our masseter closest to us, and then the parotid just behind it here. And it's a pretty large gland. It's large but thin as well. So it might be easy to destroy it. Maybe if you weren't careful removing the skin, you may have already cut through it. Hopefully not. Okay, we'll go ahead and move on. So now that we've identified the parotid and the tissue on top of the masseter, we want to kind of pull this away. So kind of try and reflect your parotid gland away from your masseter, like this. And just underneath your parotid and right behind your masseter again, you should see a more solid spongy looking structure. And that's another gland, which is our submandibular gland. So here on my pig, we can see it right here. I'm separating the masseter away from this gland. You can see it poking out right here, the submandibular gland. It's more round and easier to identify than the parotid. And I'll just go ahead and pause here for a second so that some of you can catch up. Maybe you're still removing some of the skin, or maybe you're identifying the glands. So I'll just give you a couple minutes to identify the structures in this view. Just a quick review. Here's the masseter again. And then behind it right here, this kind of thin, spongy looking tissue. Right behind it is the parotid. And then underneath the parotid, but also behind the masseter, is your submandibular gland right here. Right here. All right, so just another review real quick. So at this point, once you have your skin off, the main thing you're going to see is your masseter here, this big round muscle. And then directly behind it, you should see your parotid gland. It's this thin, kind of spongy looking tissue. Now you shouldn't have to cut through the muscle at all yet. We will be doing that shortly, but just to see the muscle and the glands, you don't need to cut through the muscle yet, just the skin. And then to get to our submandibular gland, you just want to pull your parotid back towards the ear, the pig's ear, and you should see that submandibular gland pretty much right under that parotid, but still behind the masseter. So again, I have masseter, submandibular gland here, and then parotid. All right, looks like everyone's good, so we're going to go ahead and continue with our dissection. So go ahead and pick up your scissors again. This is the point where we're kind of going to get a little aggressive with our dissection. So you're going to take your scissors and kind of go back to where you made that initial cut at the corner of the mouth. And you want to follow it towards your masseter. Now you want to get basically under your masseter and the mandible, because we're going to be cutting through the bone. So you are going to have to put some muscle into this cut. But if you're using scissors like mine, you should be able to cut through the bone, no problem. So go ahead, and you're still aiming towards the ear, the pig's ear. So that's kind of the trajectory you want. All right, so I'm under the muscle and the bone here with this, and I'm about to make my cut through the bone. And you can see how my scissors are pointing towards the pig's ear. Okay, so that's the trajectory you want. All right. All right, and that loud click was me cutting through the bone. Didn't take too much force, but it's definitely harder than cutting through the skin. Okay. I might extend it a little bit further, just like that. Okay, I'll give you all a second to do that. And then once we do that, we're going to have to flip our pig over, and we're actually going to make that same cut on the other side of its face. All right, so I'm going to go ahead and flip my pig over. I'm going to turn it a little bit, just so I can see the other side of its face and easily cut through the jaw again. So I'm going to start, just like last time, just start at the corner of the mouth, right next to the tongue. Make sure you don't cut the tongue itself, but just basically you're just putting your scissors right on the inside of its cheek. And you can see how I'm aiming towards the ear again. You make that cut. This one's just kind of through the cheek, nothing hard yet. Okay. I'm going to feel for the bone a little bit to make sure I'm cutting in the right direction. And the masseter as well. I'm going to feel for the masseter. Okay. All right. I feel like I'm underneath the bone and the muscle here, so I'm going to go ahead and make that hard cut. All right. Okay, I'm just going to extend that cut a little bit more again towards the ear. All right, we should be all the way through the bone at this point. All right, I'll give you all a few minutes to do that. So you should have the same cut on both sides of the pig's face. All right, if everyone's caught up, we'll go ahead and move on with the next step. So go ahead and lay your pig on its back. All right, and now we're going to separate its mouth. So we're going to pull down on the jaw as hard as we can to separate the structures we just cut through, okay? So go ahead and grab the jaw and the snout here and just pull them apart. Again, you're going to have to put some muscle into it. We're just going to be pulling it apart like this. So this is the view you should have. And those cuts we made earlier should make that easier. So you should have a nice open view of the mouth. You can see a lot of the structures. All right, and then we're just going to take our scissors, once we're at this point, we're going to extend those cuts a little bit more on either side, but we want to aim for the very back of the tongue, where we can kind of see the esophagus. So just go ahead and take your scissors all the way in the back like this on one side and just cut straight down into the esophagus. Okay, we just want to pull out our tongue a little bit more. There we go. All right, so hopefully everyone's gotten to this point. If not, just send us a message and we'll slow down. But so right away, looking here, we can already see a lot of structures that Dalton talked about in his presentation. So let's look at the roof of the mouth first. And you can see all these little ridges right on the roof of the mouth up here. This is what makes up the hard palate. This whole section with the ridges is the hard palate. Okay. And then just behind the hard palate, where those ridges stop, is some soft tissue right in here, and that's our soft palate. So you can definitely tell the difference between the hard palate and the soft palate. That's the roof of the mouth. Also, while we're looking at the roof of the mouth, you can see that these fetal pigs already have some teeth erupting. So here, you can see one here. We can see some coming through in the back here. And this is interesting because obviously in human babies, they're not born with any teeth. So it's interesting that these fetal pigs already have their teeth coming through. So go ahead and try to identify the hard and soft palate and the teeth in your pig. All right, and also we have this large structure here, which is the tongue, of course. And you can see little bumps on the tongue, which are the lingual papillae. And these lingual papillae contain taste buds most of the time, except for the one specific kind that does not contain taste buds, which is the filiform kind. So try to identify these little bumps, these lingual papillae, on the tongue of your pig. All right, so next we're going to open up the mouth as wide as we can and look in the very back of it. And you should see this prominent flap here, this piece of tissue. That is the epiglottis. Just follow your tongue all the way back. And if you don't see it, you may not have opened up the mouth enough. You may need to make a deeper cut on both sides of the mouth to really pull the jaw down and get that epiglottis to pop out. It's right here. It's just kind of fleshy colored. Really flexible little flap here. Once again, if you are having trouble finding your epiglottis, you may just need to pull the jaw down further, and making deeper cuts on both sides will help you do that. All right, so the epiglottis, of course, covers your airway when you swallow food or swallow anything. So if you look at the epiglottis, you want to kind of pull the head back further. So you have this kind of view. Try and look behind the epiglottis, and you should be able to see the opening into the larynx, which is your airway, and then just behind the epiglottis, which you can see in my view, is the opening to the esophagus. So I'll try and point to it here. So here we have epiglottis. See if this camera will focus for me. Here we have epiglottis. And then here is our esophagus, this hole here. That's leading down into our esophagus, which is going to take food to our stomach. Now if you pull the esophagus forward this way, oh, I'm sorry, if you pull the epiglottis towards your tongue, you might be able to see two little folds there, and that's your larynx. So that's your airway. That's what your epiglottis is protecting whenever you swallow. All right. So hopefully you're able to identify those structures. Now we're going to turn our attention back to the pig's tongue. So at this point, you're just going to want to retract that tongue backwards, so towards the roof of your mouth, of the pig's mouth, and towards the side a little bit as well. So you're looking basically underneath the tongue. Okay? You can see I'm pulling my tongue to the side like this, and I'm looking in the space between the pig's tongue and its gums, where the teeth are erupting. Now at this point, you can take scissors and just cut into that tissue there. Not too deep. Make sure you stay, just make short little cuts into that tissue. And we're going to look for another gland just below the surface of that tissue. Okay? So just be real careful. As you can see, I just made tiny little cuts at a time, just under the tongue. All right. Then I'm going to take my probe and kind of push some of that tissue that we cut through to the side, so we can see the gland better. At this point, you should be able to see a spongy substance right under that tissue. Now what we're looking for here is the sublingual gland, which makes sense because it's right under the tongue. It's kind of similar to the parotid in that it's a very thin gland, kind of flat, doesn't have a great solid structure like the submandibular, but it's still pretty easily identifiable right here where we cut it. So you should be able to see that glandular tissue right underneath the tongue. All right, so at this point, we are done with our pig dissection. So if you want, you can just set that to the side, and you can always come back to it later once we get through the rest of the dissection and look at any other structures you want. But I'm just going to set this pig aside for now, and we're going to turn our attention to the cow jaws. Now, if you don't have a cow jaw, don't worry. You can just follow along with what we're doing here. If you do, go ahead and follow along with me in completing these steps. All right, so hopefully everyone has their cow jaws ready. If you don't have cow jaws, just follow along here with me. All right, so first thing you notice is that this mandible here is huge, much bigger than a human's. But you can see here some teeth are missing. This is where the incisors and the canine should be, up in the front of the mandible here, but we can't see those, unfortunately, so we are just going to focus on the premolars and the molars with the cow jaw. So the first 3 teeth that you see should be the premolars, and then it should have 3 more towards the back of the mandible, which are the molars. And now you should have pliers at your site, so go ahead and take your pliers and try to remove one of the teeth. Now I already did this, so what I did was I took one of the front premolars, because those seem to be easier to remove. I took the very first one, and here is that right here in my glove. You can see how small that is compared to some of the other molars. So I would recommend picking one of these premolars in the front to try to take out of the cow jaw. So you may want to just take your pliers and grab on here, and then just yank as hard as you can. Nope, not that one. Here's another jaw, so you can kind of see. I'm going to pull this one here. That's how it should look when you pull out your teeth. All right, so hopefully you'll at least have one tooth pulled out. I'm going to use this tiny one here. So we're just going to look at the parts of the tooth that Dalton talked about in his presentation. All right, so right away you can see that this tooth here has the crown up top, and then the root on the bottom, and then the crown is covered by this white enamel, whereas the root is covered with cementum. Okay, so you can tell the difference between those two structures. The root is covered with enamel, or sorry, the crown is covered with enamel, and then the root is covered with cementum. Okay. Now I'm going to look at the cow jaw again. And we're going to look at the other teeth here, which are interesting because they're actually worn out quite a bit. And that's actually useful for aging the cows. So for animals like the cows and the horses, they can look at their teeth and see how worn down they are, and that kind of can indicate if they're a younger animal or if they're older. So this one is probably older because it has a lot of wearing on its teeth, which is good for us because we can identify some more layers of this tooth here. So you can see on the very outer edge, remember that white pearly covering is the enamel. Okay, so go ahead and identify that. Next, we kind of see an orangish colored layer just beneath the enamel, and that's the dentin. And then in the very center of the tooth, you can see the pulp. And that's where all the blood vessels and nerves were. Okay, so we have the enamel on the outside, dentin in the middle, which is kind of orange, and then the pulp right in the middle of the tooth. Okay, so hopefully you were able to identify all of those structures. So now we're just going to show one last thing. Here we have a deer jaw. Now this is something that only we have at this site. I don't think any of the other sites have this, but I just wanted to show this to you guys so you could see the incisors and the canines here. We already talked about the premolars and the molars on the cow jaw, which is deer jaw also has. But I also wanted to show you, so we have our incisors in the very front, and then the teeth on the very outside of the incisors on each side. This one here, and then this one on this side. These are the canines. Okay. So that's it for our dissection today. The rest of the time is your guys' free time to look at the fetal pig again, look at any other structures you want to see, maybe look at the cow jaws more. It's up to you. From there, once you're done taking any extra time with the specimens, go ahead and follow the instructions of your site coordinator. In the meantime, though, we'll be here to answer any questions you have. So go ahead and just send us a chat if you have a question, and we'll get back to you. Thanks.